examines the role of consumers in the digital health revolution. Perfect for CES. As businesses, we should expect everyday people to adopt our technologies, or do we need to follow the consumer's lead? And how do you mobilize communities through technology to contribute to their own health and well-being? And most importantly, how do we make products that resonate with people and help grow the health industry overall? I'm very honored to introduce you to our moderator, Robert B. McCray, President and CEO of the Wireless Life Sciences Alliance, a trade organization dedicated to creating value and improving global health through the convergence of communication technologies, consumers, caregivers, and all sectors of the life sciences and technology environment. In addition to his role with the Alliance, Rob brings more than 25 years of experience as a business owner, senior operating executive, and legal and transactional advisor to private and public companies. It's all yours.
Thank you. So good morning, still morning. That was a good panel. We had great people. And we're probably going to bring the discussion a little bit closer to ground. We have 50 minutes. We have a lot of questions that I've prepped with the panel, and but let's plan to get some from the audience as well in the last 10 or 15 minutes. So the Wireless Life Sciences Alliance, which is the organization that I co-created about 8 years ago, was brought together to bring together healthcare and technology industries. So Qualcomm and J&J were our initial financial sponsors, and that's sort of the metaphor, you know, just 8 years ago about we need to get more technology and healthcare, and especially communications technology, working together to address some fundamental problems in healthcare. Now, kind of the third leg of the triangle has been established, and so organizations like Procter & Gamble have come into our organization and others as major partners and major sponsors. So now we have healthcare, technology, and consumer sectors, and in that convergence is where we can have some solutions, where we can bend the cost curve, where we can address what is the largest addressable market in the world today, and that is health and healthcare. It's a global market. Accessibility is guaranteed by 5 million and counting mobile phone subscribers, by 6 billion people in the world that are accessible to cellular networks, by the technology that is separating computing and communications from sensors, and all those other technologies that will allow us to sensorize human beings, like Eric Topol was discussing, but also things and move information and data from where it is to where it needs to be so that it can be managed, analyzed, made more efficient, and fed back with decision support and recommendations to the appropriate person at the appropriate time. That is the promise of what we're doing. And so just for purpose, these lights are terrible. Can I just get a sense to whether I can see it? If we say healthcare, technology, and consumer, those are the three sectors. Can I have a show of hands? First, healthcare. Who here is sort of in the healthcare world? All right. And who is technology? And more technology. And who consumer sector? Okay, and the rest of you are undeclared, so that's fine. So roughly equal portions. That's just for the benefit of the panelists, so we know kind of how to direct some of this conversation. So I've been in healthcare for 30 years, about a 3-year interlude into digital music in 2000, plus or minus a couple of years, crazy times. Just from my perspective, healthcare is broken. You guys heard all of that. You probably know it. It's too expensive. We don't have access. Too many people don't have access to health and healthcare, lack of knowledge and all of that. It has to be changed. It will be disrupted. Data does that. Information does that. It blew up the music industry as we knew it. And now it's the entertainment sector, which is 10 times as large as the music industry ever was. And it is personal. You can go get what you want, and you only have to pay for what you want. That's where, that's kind of a metaphor for where we may be able to go. So we're going to talk about this notion of the patient as consumer. And, in the wireless health, mobile health, digital health spectrum, there are actually dialogues going on. Well, patients can't be consumers, and consumers, it's sort of, we're not going to get to that level. That's not important. But the notion is that consumers, we as individuals, and this is a global phenomenon, are becoming increasingly responsible financially and personally for our own care, for our children's, our parents' care, for managing it. And like it or not, it's the way it is because, as Dr. Tuxson pointed out more than once, we're going broke. We will not spend more money on healthcare. We just have to use what we can spend more wisely or improve our efficiency so much that we can afford to do all this. And again, so how do we get there? One bit of confusion, I think, out of the earlier session I want to fix. There are two overlapping markets in wireless, mobile, digital, connected health. One is the traditional healthcare market where devices are regulated, software and services are regulated to some degree, and you have reimbursement from the federal government and other payers and insurance coverage. That's the traditional healthcare market. The emerging market is consumer health, wellness, fitness, and moving medical devices into this less regulated, mostly unregulated market. They are overlapping, they are separate. If you are an entrepreneur, if you have knowledge about healthcare IP, if you have knowledge about how to bend behavior, you can sit down and decide, I'm going to go after one or the other of those markets. You don't have to be in both. You can avoid significant levels of regulation. So there are opportunities to just create stuff and throw some of the stuff against the wall. And you don't have to get into the dialogue. You just have to figure out how to get people to buy it and create the long-term success for it. So, all right. So with that, what we have here on the panel are two suppliers and one of the biggest purchasers of healthcare in the world. In terms of scale, Gary Shapiro in his keynote yesterday pointed out that this year the consumer electronics industry in the U.S. will pass $200 billion in sales. Healthcare industry in the U.S. alone was $2.6 trillion in spending in 2010. It's apples and oranges, but we're talking about immense amounts of opportunity just from a business perspective. So first, we'll just do some quick introductions, and then we'll sit down and have a little dialogue. So on your far right, Christine Robbins is CEO of BodyMedia. I love this company. I've liked it since just after it was started. It's a consumer device-oriented company. It incorporates clinical-grade sensors and algorithms to support mostly weight management. So let's start with Chris, and then I'll introduce each of the speakers. They'll kind of state what their perspective is on the consumer as patient or the patient as consumer, and then we'll get into some quick Q&A. All right, so Christine?
Great, thanks, Rob. So just quickly, BodyMedia as a company has been around for about 12 years. Our expertise is in on-body monitoring, and we have a series of sensors that gather 5,000 data points a minute off the body. And over the course of 12 years, we've transitioned from originally a clinical research application in marketplace and some medical applications to a more what I consider a consumer med tech company. So consumer actually purchases our product, but it's influenced by a medical professional of some sort or an influencer. But we also have an extensive clinical validation and outcome portfolio. We are a Class 2 FDA medical regulated device. So some interesting characteristics of our business. And as Rob mentioned, we've positioned our product in our software right now anyways for a weight management application and helping people understand that 24/7 perspective on managing their lifestyle. So in terms of the patient as consumer, we've kind of over the course of 12 years lived that transition. And how do we take the intense amount of data that we have and start to empower people to understand what they're doing, how they can affect behavior change, and we've developed both innovations and partnerships to start to further that. And so I think the topic is very interesting as we look at what's going on with technology and people's just acceptance of what technology can do in healthcare. I think Steve Jobs, bless his heart, really changed what people are now expecting out of technology and how integrated it becomes in their life. And so very topical, and I think the trend in terms of where the whole space is going.
Well, thank you. And we'll come back to it perhaps, but in Europe, BodyMedia has been sold as a prescribed device by the clinical community.
Yes, it's a COPD-focused business there.
That's an example of a crossover in looking at two different markets and approaching them in two different ways.
Yep.
So next in the middle of the panel is Jason Goldberg, the CEO of Ideal Life, a terrific company. I think it was started with sort of out of a consumer's frustration with the inability to offer support for aging family members, I think, parents, right? So, so with Ideal Life, my characterization is they have consumer-friendly but more basically traditional healthcare monitoring platforms for use outside of hospitals and clinics, i.e. for use in settings where you are responsible for it, not a nurse or a technician or a doctor. So, Jason?
No, thanks for the introduction. Ideal Life and what we do, again, it grew out of my frustration in not so much to develop a cure for these issues around chronic condition management, more tools to better connect us with the right information around health management, specifically around chronic conditions. What we do today, we've designed and developed innovative consumer-facing products that are equipped with innovative technologies, communicate the right information at the right time in the right way to the right people, and software solutions on the information management end that allows us to operationalize that data. And I think from the perspective of not so much patient as consumer, but more, as you mentioned just when you were about to leave the podium, consumer as patient, for the first time you're able to see today the ability to deliver a scalable opportunity in the self-assembly of the personal health record. And what that allows us to do today, not only our company, innovative companies like BodyMedia and others, allows us to deliver that method for individuals to take control of their own health or that of their loved ones, but most importantly, allow providers to be empowered with actionable data. And you never had that capability before. And what that allows us to do, and really from our perspective as a company, and what we look to do is not only communicate data to space and the cloud and not know what to do with it, but really to deliver at the new point of care, which is around the mobile patient, which is around the individual health consumer, no matter where they are, at point of care, behavior change and knowledge. And that allows us to really take for the first time chronic conditions and allow them to be managed in a very sustainable way on a long-term basis, not just reactionary or post-acute interventions, but really look at the long-term management of health through information. And really, I think that's the key here, where for the first time we're able to deliver in a very scalable way for consumers that health-connected platform that allows providers to take advantage of the data. And that's really where we started, although it was conceived as a very consumer-focused oriented product. We still see the health consumer as the centerpiece, but what we've done today, we've been able to become leaders in the space to provide services to the plans, the providers, hospital systems, where we see it as a transition to the direct-to-consumer model where people really direct-to-member services. And I'm sure my colleague here will talk more about that, really as the forefront of the new way of managing chronic conditions.
Right. So BodyMedia, direct-to-consumer in the U.S., has some distribution relationships, which I'm sure Chris will talk about. Ideal Life using more traditional healthcare distribution channels and partners to deploy devices that are consumer-friendly, tackling the plug-and-play issue. As we all know, that's so important in consumer world. So finally, we have Tina Brown-Stevenson, and she's the Chief Clinical Informatics Officer of OptumInsight. And you know it's a big company when there's a Chief Clinical Informatics Officer. It's terrific to have Tina with us. OptumInsight is part of the Optum and United Health Group family of companies that are the most influential healthcare purchasing and analytics company in the U.S. It serves the healthcare sector. It serves a full range of healthcare sector. Increasingly, as the market is changing, It's becoming more of a direct provider. That's a trend that's happening. We have lots of really interesting things going on, and Tina is right at the center of traditional healthcare in the U.S., but seeing changes going on because traditional companies are doing untraditional things for the healthcare sector.
Absolutely.
Tina?
It's exciting to be here. You know, it's, the most exciting thing about working at a company like Optum is that we work across all of the silos of the health system, and doing that helps us to better understand where it really isn't servicing the best interests of the consumers, which is what we're interested in discussing today. So we service over 400 life sciences and pharma companies, over 6,000 hospitals, almost every insurer in the United States, with data management and other types of services, as well as over 30 of the Medicaid programs across the country and those various states and how they manage their data. And one of the things that we see is that all the data is oriented towards servicing those enterprises and those lines of businesses. It's not very centered around the consumer and an individual's health. There's a lot of data out there and a lot of opportunity to turn a lot of this on its side and make it much more available and integrated, as my colleague Reed, you can imagine the conversations Reed and I have about this stuff, around how do we bring this wonderful engine of information and knowledge and decision support to bear where it matters the most, which is when we each make our own individual health decisions along with our physicians and others. So yes, we're in a lot of places, and there's a lot of data, and there's a lot of issues with having a lot of that data, and hopefully we'll talk about that today.
And we will. So let me ask Tina the first question. Can you just provide, from your perspective, an overview for the audience of kind of the major market forces that are, driving consumerization in healthcare here in the U.S.?
Well, there's an awful lot of dynamics to that, and a lot of it came up in the last discussion, which is around, one, healthcare is very expensive, and a lot of people don't have access to it. So if we look at what the states and the federal government, we do a lot of work with NIH and AHRQ and CMS around what they're trying to do, which is to understand where their dollars are going and to help consumers to make better decisions around those dollars. So we've got the state and federal governments working really hard to make that happen and to expand healthcare to many more people, as you know, under all the recent regulations. So that's one force. The second is hospitals and physicians are getting squeezed relative to what they can actually earn as healthcare providers. They're being asked to provide more value, to provide evidence of their value, to get paid based on quality, not just on how many widgets and how many people they operate on, but how much better the people are getting that they're responsible for. And 40%, based on the most recent literature, of those outcomes are often based on the decisions that consumers make. So now we've got hospitals and accountable care organizations who are responsible for groups, populations of people, and 40%, based on a lot of the data that we've seen, of their ability to stay afloat is going to be based on decisions that consumers make. So not having the individual patients, consumers, and families and caregivers in the information game, they are actors in this play, as well as hospitals and physicians. They need to know their role, and most want to participate and want the data and information, so long as it is translated in a way that they can understand it. And that's really critically important. There's so much out there that we can bombard you with technobabble or medical terminology babble that the average consumer will not be able to digest and will just confuse them and make them more frustrated. I don't know if you've ever talked to like a tax attorney trying to figure out your taxes or something, and they're talking all this stuff and you're going, wait a minute, you're supposed to be helping me? I think that we're going to see a lot of those kinds of reactions if we don't create the translations that help people to feel more empowered rather than more confused about what's going on with their health.
Mm-hmm. So actionable information.
Absolutely.
Somehow, which gets into that coaching discussion that the previous panel was having and who's going to organize this and so forth. So earlier panel also talked about the fact of, sort of money works. Follow the money and you see what incentives are. Compensation plans work. We compensate institutions to do more traditionally. Starting to get away from that a little bit. One of the changes that's going to happen in 2012 with the Medicare program is to stop paying hospitals for readmitting certain types of categories of patients if they come back within 30 days, and that'll get extended over time. This has generated a lot of additional interest in wireless and connected health and remote monitoring and management because it forces hospitals to think outside their walls. Maybe, Jason, are you seeing, is that relevant to your real-time discussions this year and last year?
Quite relevant, and it has definitely expedited the opportunity for organizations like hospital systems and other organizations to take advantage of technology in a way that they have not done in the past, and to think about the implementation of technology to assist them in staying connected or staying in touch with individuals out there in the community once they leave the office walls of the hospital or physician office, to ensure that they keep tabs on them so that they don't come back within 30 days. And what's more important is that 30 days is extending to 60 and to 90 days. And just as important as the penalties in reimbursement, it's also, and Tina, you can probably speak more of this than I can, is the shift in payment to quality and patient satisfaction. So as an extension to what Tina was talking about earlier, you're seeing the unfortunate shift in the financial burden being placed on the consumer that is really driving the need for consumers to take steps to understand what they need to be doing around their health. Market forces like changes in policy that we're seeing, regardless of what's going to happen in the end with the Health Act or not, but all these types of components that are coming down the line, like what you just mentioned now, are offering tremendous opportunity for us to think about ways in which traditional players have been playing in the field with healthcare services, and really flipping that on its head and doing different things and implementing technology. And the nice thing that's happened, and that's but one example of a policy shift that enabled groups to think about technology, is that it's not just thinking about, okay, should I be using technology or not? It's really more about, we know that this is something that we have to tackle. We accept the fact that technology can assist us in doing that. What are the right technologies to deploy? How should we deploy them? So it's really more about the implementation component, which is exciting for us as an organization that has a lot of experience in that and implementing programs that think of the consumer, which is really most important. And that's where you're starting to see a lot of the market forces enable the transition to a more consumer-facing opportunity in health services.
So I want to turn to Chris and see how far that's going now, and from your perspective, because you've been in the game for a few years now, and you use the sort of doctor influencer model. All the dentists like Crest, and I mean Procter & Gamble and some other companies sort of started that trend. They figured that one out a long time ago, and I think that's kind of part of what's in your DNA. But so beyond readmission, we're also, from a policy perspective, trying to redirect some of the spending in healthcare to get providers, institutions, make them financially responsible for outcomes, and therefore push them to be more, thinking more broadly about the range of services and patient education and pre-patient education, keeping them out of the hospital and so forth. So are you getting any of the draft of that via your direct and sort of indirect efforts?
Yeah, exactly, we are. And probably from two different perspectives. Number one is, traditional healthcare, and probably more on the progressive end of healthcare, they're looking for different ways to engage their patients. They can only engage in dialogue to the extent that the patient tells them when they're in the office. And so we've been approached by pharma companies, for instance, to, partner with our lifestyle management body monitoring technology so that they can help understand. One was a fibromyalgia patient population, and a couple other patient populations where the drug engagement is not there, the compliance isn't there, and so the doctor, physician wants to have a more integrated lifestyle conversation with the patient to see how that's playing into their drug compliance. So we're getting that conversation, as well as, kind of going back to the dialogue Jason was having, and our partnership we just announced last week with Avery Dennison Medical is a classic example of having the ability to monitor patients, in a remote basis, and vital signs and things like that are important, but so is their lifestyle and the context, you can imagine a cardiac patient released from the hospital, and their lifestyle and their activity is as important as what's going on with, their heart variability. And so our partnership with Avery Dennison will now, kind of allow that development. They're interested in taking our sensor technology into some of those acute remote monitoring applications that aren't strategic for us, but where, lifestyle and body monitoring is important, and they, have expertise in those markets. So we're kind of getting it from a number of different perspectives.
So your technology will be inside
Yes.
a more traditional
Yep.
device and application.
Yep.
Well, that's interesting. I love that one because two of our members, Proteus Biomedical, is inside the Avery Dennison.
Yeah, it's kind of a three-way,
and so,
Proteus,
yeah,
Avery, and BodyMedia.
Love having members come together like that.
Well, I think that's a trend, right? I
Yep.
mean, no one's going to have the one solution, and so figuring out how you work simplistically in an ecosystem is going
Yep.
to be important.
So, you've had to work hard to try to make your device good. So, and I mean, are health technology companies going to come up to the Apple standard of elegance and simplicity?
I think that's where the bar is. That's what we're all aiming for. Although Tina, put the challenge out there that we see, is kind of where we go next, is how do you turn the data into something that's relevant and understandable, and also how do you start to help people understand what to do with it, and be able to integrate other things, whether it's blood pressure, and if you're diabetic, your glucose, all in one place, right? I don't, electronic health records or personal health records have struggled. How do you make that data come together simplistically and help the patient, the end user, interpret it all together? And what does it mean for them, not just present it as a download of data?
Right. So let's turn to that. And Tina, I'll come back to you to start this. So we can produce all this data. Doctors don't want it. We all have friends who probably do spreadsheets of, a handful of their vital signs and want to show it to somebody, and nobody wants that. Institutions aren't designed to deal with that now, but it's happening, right? People are getting it. Something's going to happen. Kind of at the highest level, what are your predictions about who is going to organize it? Is anyone going to organize it? How does it become sensible for for the clinicians, for the patients, to use this information?
Well, I think that the way that we're approaching it is that if the information is just digitized pieces of paper that add more nonsense to the daily activity that clinicians and patients and everyone else has to go through, it will be discarded very readily. It won't be useful. And I can give you an example. We work with tons of physician groups all over the country, and we actually manage some physician groups. And Reed mentioned the health information exchanges, which is taking data from, kind of a medical trading area and providing it to you if you're an appropriate clinician for my care. You get that data. Well, if I go down the hospital down the street and I go to get a bunionectomy done on my foot, and I have blood work done, all of that stuff's going to come into your office. You didn't order it. You weren't looking for it. So now we've actually got clinicians saying, now, wait a minute, what does that mean? What if there's something in that data that I need to know, and I don't do something about it? Am I liable for that now? Because that data came into me, right? Another is situations where the data is still not compatible. Data is not just data. Every system doesn't work. So we have clinicians that are getting radiology reports from certain institutions that don't fit with their technology. So it comes in and it sits in a cache, just in a space outside their data set. And if they want to use it, they have to manually pluck it out to find out, did the women get the mammograms? So what did the doctors do in that situation? They shut the feed off. They shut the data off. And so what we've got to be really cautious about is that we don't create an avalanche of stuff that is not managed. And that's what we talk about decision support within the workflow. Something has to take that information and make it smart and not just digitized and dumped. And it has to say to the clinicians, the office manager, the nurse practitioner, whoever is responsible for that, it has to be able to flag and say, this is important and this is not. And increasingly, what is also happening is when we talk about data that's coming in now that's digitized, it's different than it used to be. Because if you order a lab test, you don't get back one lab test. You get 27 different values for different things related to that lab test, that blood draw that was done. And it has to interact with the history of the patient that's already there, as well as interact with each other. So when you talk about decision support in the new age, it's really different than it used to be. Never mind all the discussions we just had about genomics and adding that kind of information to a primary care doctor's office for somebody that just had a lab drawn down the street. So what we believe is really important, and we are working in this space very heavily, is adding intelligence to that flow, is understanding the pace of the testing, the sequencing, the patterning, as well as the interaction between all those data variables to make life better, simpler, and actionable for the people that care about the data.
So, you know, if you have a nice car for the last 10 or 15 years, it was built in with lots of sensors about the brakes and the engine and the coolant and everything, and it was communicating with the outside world. It would give you alerts inside the car. It could send you an email. It could service company that calls, it's time to get that car in. So this is all technologically possible in the near term for us as individuals. Who's the organizer? Is this a United Optum type opportunity? Is it Microsoft? Is it Google? Is it a new entrant? Who actually do you see is likely to step up and actually provide this service? It's a massive business opportunity.
There are many organizations who are in the health space who are working in this. We are working in it because we want better outcomes, and we want the clinicians to use the data to propel better outcomes for patients and better interactions. That's our skin in the game. It's important to us. And just so you know, we have two kind of sides. We have the Optum side, which is the services side, and we have the insurance side, which is the United Healthcare side of our business, owned by one company called United Health Group. And so we actually provide disease management, wellness, all of those things. It's part of what we are, and it's important for us to help the primary people who do that to do that. But there's Cerner and Epic and many other, IBM, doing lots of very interesting things, and we're working with a lot of these different companies to help to make the clinician's life manageable as the data and information age just explodes on them.
So Jason, is there a startups opportunity here?
Yeah, there are definitely startup opportunities. I mean, we're participating a lot in that area as a mature organization. And I think what Tina mentioned really answered the question. We're looking more at healthcare as a collaborative opportunity, finally, which I think has been a real transformational change over the last number of years. And for the first time ever, we're seeing a collaboration of providers, actors, participants, the patients, everyone across the care continuum. And I think your example is a good one with the cars. I don't know much about cars, unfortunately. So I know that there are a lot of things that are going on under the hood that potentially can cause a problem. And there are a lot of things that are measured, a lot of data that's being sent out through all these sensors. But all I care about is if that yellow engine light comes on, I know that I can take it to the garage. And I think what Tina mentioned, and it's a good metaphor for what's happening now, companies like ours and others like Optum, we're all working together, organizations like Christine's, where we're taking a lot of this information and making it more intelligent. And I challenge the comment that you mentioned earlier, where physicians today are interested in that information. Unlike before, there are some questions around liability, but they're tackling that in different ways where they're looking to provide care for patients. And they say, you know what, I work between these number of hours, and this is what I do. I want that information because it allows me to become more intelligent and have a better conversation with you about your health, as opposed to the 1 or 2 blood pressure readings I had over the last 12 months. Now I understand a trend when you come into me, and I don't have to try and capture information. So I would say that, yes, the physicians want that information. The pharmacy is interested in a different bit of information. And as a consumer looking after a grandparent or a parent, I'm interested in that alert to my cell phone or SMS about a high or low reading or a fall. So I would say, yes, everyone is interested in that information, but it's only useful if it's managed. And we can manage conditions if we measure the data. You can't manage what you can't measure. So yes, groups are interested in the data. The data is becoming smart, intelligent information to allow us to become more knowledgeable. So you do need that silo to ensure that, yes, the physician receives the trended graph that he's interested in, not the alerts that maybe the nurse practitioner or case manager are dealing with, or the family member. So those are the things that are happening today that makes this quite an exciting time for both startups, a lot of mature organizations. So it's quite an exciting time. And everyone, there's no one answer. You know, there are a lot of different physicians that have a lot of different ideas and protocols, whether they accept them or tailor them. You know, it's the power of one, the patient as an experience.
So Sean Fanning didn't ask Universal or Sony's permission to create Napster, and it just made all songs accessible to consumers, and it tore down the industry. It broke, eventually, it took 10 years, but it broke up the album. The model of selling 10, 12, 15 songs on a CD, and you had to take whatever they bought. It blew it up, finally. So Chris, so let's forget hospitals and doctors and so forth, because a lot of this information is going to be directly accessible to consumers.
Yep.
You can go online and you can order devices to be shipped from other countries that aren't approved here, but you can do it, and some people do that. And there's a lot of consumer grade or clinical grade technology available to consumers today. So you can learn a lot about yourself. You can quantify yourself, to use that term.
You could also measure the satisfaction of consumers in going to certain hospitals, doctors, and assess, I think, is probably pertinent.
So you're getting to where I'm going, because I think this opportunity to organize this data, help consumers be more knowledgeable and self-sufficient, is a business opportunity. You're at some level in that, but in addition, we also have the other problem. How many health and wellness and fitness apps are there in the iTunes store? 50,000, 100,000? It's unbelievable. How do you know? I mean, how does a consumer separate what's good from what's not?
I think they're all good, at some level, right? Okay. Let's put it this way, there's 150 million Americans that are either overweight or obese, right? And there isn't going to be any one solution that's going to help us solve that epidemic, and it becomes a precursor for so many. So it's important to think about, what's relevant for various people, various stages in their life. I mean, what a 20-year-old is willing to engage in is different than someone older. Someone who's tried some things, maybe simple apps on their phones, that's not enough, or it's not simple enough, it's not integrated enough, and they want something. There's a lot of manual entry, and so then there's devices such as BodyMedia that have come along and helped them simplify that information gathering. They don't have to log it; it's just there, and so it'll evolve over time. There's two ways. It's either going to be the app on the phone, or an accessory, if you will, that speaks to that phone, that's going to help people better manage their lifestyle.
But some trusted organization has to help sort through that.
Yeah, and that's a challenge. I mean, there's a lot of conversation now about FDA wanting to regulate health apps and things like that on the phone, and are they, aren't they, and where does the line get drawn? Yeah. Obviously, we're on one side of the line already as an FDA-regulated product, but that world is going to change quite a bit, I think, as this category. If I think back 12 years ago when BodyMedia started, nobody would have imagined that anybody would want to engage in, on their own, want to go to Costco and buy a device that, you could strap on your arm and understand your activity, your sleep, and how you can better manage your weight and your lifestyle. And we have a very big, thriving business there today. So, it's the category is moving and shifting very quickly in the last couple of years.
Okay, so let's, if anybody has some questions, why don't we come up to the mic? I'll ask kind of one more. This is sort of a higher level. Are we creating a new digital divide? I mean, a lot of this stuff that's out there is sort of for the healthy and wealthy, and we have, tens of millions of uninsured, underserved folks in this country and billions around the world. Is this all going to help the rest of the population? For anybody?
From my perspective, and to the point earlier, there's a lot more noise and clutter that has to be deciphered, and around the opportunity in ensuring that there is no digital divide. As a company, we believe in scalable solutions and creating access for people that traditionally did not have access. So there will be the need for populations to have access through the payer community and providers. Others will be able to afford different types of products, but from my perspective, the real opportunity in helping the millions of people out there is providing access through technology, which makes things affordable and connected unlike ever before, allowing us to provide different programs and services around health management that are affordable in nature.
Good. Well, I'm an evangelist, and there's about $10 trillion of healthcare spending around the world probably right now on an annual basis. All you want to do is to redirect some of that to your businesses, and we do need that innovation and new players. So let's go to the first question. I cannot see who it is.
Hi, my name is Howard Granite, and I'm with a company called Palladium Energy, and we're one of the premier battery pack manufacturers for many of the consumer electronics products. And we've also spent a lot of energy into the diabetes management world. And also I'm an avid cyclist. So I kind of come from a sector where we're constantly in the racing community monitoring our data through companies like Garmin and other companies that do power management. And my question really goes to kind of the tie-in of that community and how it can transfer over to others, because as we're talking about preventative measures, everybody knows that exercise is such a key element. And it's very tough to kind of manage that element within the healthcare segment. So with that being said, in your technologies that we're looking at, do you see a possible incentivization from the insurance companies to basically, say, have a patient that is overweight to potentially wear this type of device to monitor it, to help with the management there, or on the other hand, also for somebody who's very healthy to be able to wear these type of devices to maybe get a break on their insurance rates because of the positive activities that they're doing?
Yeah.
Good question. Chris?
I can give you a real world example. We have a corporate wellness customer that we're just about ready to launch who is interested, and they don't want to necessarily get involved in all of activity monitoring. It's just if they have a client who takes a HRA and that suggests that they're overweight, they have their rewards-based system, and so what they want to do is, if it comes out that the HRA suggests they need to lose weight, they'll recommend purchase a BodyMedia, and if they purchase a BodyMedia device, they'll get points. And then they want to ensure the engagement with the device, because manual tracking is one thing, and that's, you can reimburse and reward on that, but that's tricky. And so what they want to do, technology doesn't lie, and data doesn't lie, and especially a technology like ours. And so they have usage parameters. You have to wear it so many days a week. You have to log your food so many times a week. And then you will get points based on that, and those points then can be redeemed for reduction in premiums. So those models are out there, and we're seeing customers come every day. In fact, I just had to hire someone in corporate wellness because the requests are becoming, quite large for us.
We're seeing the same. I won't pile on, but very, very similar device usage with different benefit plans, with reductions in premiums or certain types of points where you gain share, so to speak. The more you do, the more you get back.
Yeah.
Great.
In a very quantified, objective way. Yeah.
Thank you.
It was interesting you were talking about, I think, measuring metrics for measuring health using, let's say, a pedometer, and then you would get a discount on your health insurance, right? Because it's a very, but what if you had some sort of heart rate monitor and you'd have too high of a heart rate, you then get punished for that. But I guess my question was really, if you have all this data, tons of data, and but a lot of it's only very little you actually use, and the devices often they often can figure out themselves when you're in a let's say yellow, green, or red situation. I have a NAS system, and most of them they tell you the speed of the car, but my NAS system also tells me what the maximum speed is on that stretch of road. So when I go too fast or 5 miles above the speed limit, part of the screen turns red, right? So you could have that too for some sort of heart rate monitor that you're wearing, or a pedometer. If you take less than a certain amount of steps per day, it turns yellow or red. If it's okay, it's green. And the same thing with the heart rate or blood pressure. So you sort of that built in this smart software you were talking about. Do you have any comments about that?
Well, I would say, I mean, I think in Optum's a classic example. We just actually launched a little bit of a partnership with them, and they're good at what they're good at, and we're good at what we're good at, and where the world is going is how we work together, because their expertise isn't in devices, and whether it's our device or the next device, they're looking to be ubiquitous, and I think you're going to see more and more of that, from a technology standpoint in the industry, and rewarding on whatever it is you decide to use or whatever you decide to engage in terms of a device.
But you have a good point. If we can merge the clinical parameter with the exercise parameter, it gets even stronger. So if you do have some level of thickening of the heart and you don't want your heart rate to go above a certain, there is the ability for monitors nowadays to help you to stay within that window of what's healthy for you relative to your condition. So you're absolutely right, and all of these can do that. Are we doing all of that with everything now? No, we're just trying to get some people to get up and move. Really.
And to add to that point, I mean, you brought up a few things in your comments, is that engaging individuals through different ways is really the key factor. Unfortunately, most of us, myself included, don't like to exercise, although we know that we should be exercising. Rewarding that and incentivizing that through either simple gaming solutions or innovative ways in knowing that actually these things are helping me. The power of engagement is a critical factor. There's also a whole other psychology segment around rewards and incentives. Is it more powerful for some people that they like to be penalized, and that's what motivates them to do things? Other people like to be rewarded. There are a lot of interesting studies that have come out as of late where people are not incentivized of what they might receive on their co-payment, but they start with a pool of money, and if they start doing things incorrectly, they're going to start losing things. So it's a whole different dynamic, and again, we go back to the power of one and personalization. We have the power of all these tools to measure, manage, monitor, engage individuals. Unfortunately, all of us like different things. That has to come into the equation. The power of protocols and data sets, it's a whole interesting category, but that's why the opportunity for a lot of different startups, traditional companies, organizations, as long as we work together collectively and deliver these types of solutions, we're going to get to where we want to go.
Yeah, I'm going to pile on because, we have plenty of technology, and its pace of technology innovation is so fast that if what we don't have now, we'll have it in 2, 3, 4 years. Healthcare, life sciences knowledge, Greg Lucier, that's the Moore's law is like this, and the curve on DNA sequencing is so much steeper. We're going to have more life sciences knowledge than we know what to do with. It's that third leg of the triangle, it's us. And the famous long-dead character Pogo said, we have met the enemy and it is us. And if you think about the cost of healthcare and what drives it, it is a lot of human behavior. So the knowledge about how to engage with human beings of all different cultures, different perspectives, different problems, and bend their behavior, that is where a lot of the gold is, and you don't have to be a PhD or a MD to get into that. We all have a lot of knowledge about that. So it's really a tremendous opportunity, and it is the most important for society. So I'm sorry, I think we have, Jill, we got time for one more question? One more, okay.
Hi, my name is Kenneth. I'm coming from Mountain View, California. I'm an app developer. Last couple of months, I've been building the readmission system for a hospital, targeting for Washington, D.C.'s readmission challenge, and we got a reward on it. But during the process, I figured out for the hospital information, it's not that easy for a general public to access it. So basically, we try to get the data to access with the personal behavioral changing to merge it so that they can easily go back and measure how to get back on shape after they come back from the hospital and reduce the chance to go back readmission again. So as the private sector or general public, what's your guys' suggestions to encourage or either the government side or set up the penalty or encourage the hospital to involve on it or release those informations to help the general public to be more aware for their health? So this is my question.
Quick.
Well, I mean, the new regulations are saying that if we have hospital systems we're working with now that will lose tens of millions of dollars annually if they don't solve their readmission rate problem. So I think that based on that regulation alone, you're going to see many, many more efforts put forth to help consumers and patients and families to stay in place, to be able to stay at home in a well way, not just keep them out, but to help them to stay well, to keep out. I think you'll see it much, much more.
It's the money. For hospitals, it's the money. That's what changes. So thank you. Let's thank the panelists. A terrific job. Okay.